My name is Tyler. I'm with Occupational Therapy, and I'm going to demonstrate donning lift pants. So first thing you want to do is have the correct orientation for the lift pants. The tag in the back is going to be at the back of the patient, and the black mesh is going to be the side that's facing the patient. Before donning the lift pants, you want to have the patient either don pants or ensure that there are chuck pads under the patient to ensure patient skin integrity. Start by lining out the lift pants, kind of measuring out where to actually place the pants. Have your patient then roll to their side in the bed. Start by tucking the lift pants around the iliac crest of the patient. You want to tuck the buckles here to ensure the skin integrity of the patient is intact. Roll the lift pants as you tuck. Ensure that you have enough fabric here so that the lift pants can fold over the patient. Now that we have our pants in place, we're going to have our patient roll back toward yourself and pull out the other side. Go ahead and have your patient lay flat. Lift one leg and bring the lift pants between the legs to the front. As you place the buckles, ensure both buckles are attached and tighten the straps as appropriate. Ensure that the sling straps are still visible and free. We're going to go to both sides and apply both straps. Ensure that the buckles are a tight fit. All right, at this point, you're gonna either place padding or towels here to ensure that the patient's skin will not be pinched. We're gonna have the patient now sit on the edge of the bed. Now that the patient is in place, we're going to widen the base of the lift. Prior to getting the patient to the edge of the bed, ensure that the bed is at appropriate height to allow clearance for the legs. Approach the patient, but be ensured to not hit the patient with the lift bar. You want the head portion of the lift for the back straps and the foot portion of the lift bar for the front straps. For the lift pants, the straps here are color coded, and the colors are to signify different heights of the patient. If you have a shorter patient, you're going to want to use the tallest setting. And for a taller patient, you want to use the lowest setting to allow clearance of the bed. So we're going to use the medium setting here. Sometimes you may want to adjust the height discrepancy between the back and the front. Now that the straps are applied, we can place a walker in front of the patient to assist with safe standing. As you elevate the lift, you can have the patient place their arms anywhere that feels comfortable for the patient and also does not allow their arms to get pinched within the straps as the lift raises. Now can I have you go ahead and hold on to the bar? Thank you. Now we're going to elevate the lift. Alright. At this point, you may want to instruct the patient to place at least one arm on the walker if they are able to. We're going to give a little bit more assistance in lifting the patient and then have the patient try to stand on their own. Are you okay? At this point, the patient is clearing the bed. We're going to have the patient attempt to try to stand. There we go. With the patient standing, you can elevate the lift to try to give a little bit more assistance and safety for the patient. And before the patient goes to sit down, we're going to lower the lift slightly and have the patient make their descent to the bed as we lower.